Hello, welcome everyone. Uh, Welcome to the next edition of our open evening. And we are here to share with you what we have to offer, introduce ourselves, and hopefully give you some information about what your journey is going to be like and how we can help you um, complete this journey and overcome the challenges that it presents. So we're going to start with the presentation, and but while I'm doing this presentation, please feel free to post your questions. I have my colleague Jackie who will be answering your questions as we go along, and we would love to hear your feedback so that we can make this better for you, and so that this this helps you in the best way possible. Unfortunately, due to technical issues, we are unable to share the clinic video with you today, but we will certainly put in send you a link, and you should be able to do a virtual tour of our clinic through that. So I'm Abha Bhatt. I'm one of the consultants here at Herts Essex. Jackie McAdam, one of our senior fertility nurse, is here with us, and she'll be answering your questions. And of course, Marna Marks, our marketing manager, is going to be a part of this meeting, and she's overlooking the entire thing and has helped set everything up. So here we go. Herts Essex Fertility Center was founded in 1989. We are a state-of-the-art, purpose-built clinic, and all the procedures that you need to have for your fertility journey are done under one roof. So you don't have to go for any part of the procedure anywhere else. And in the over 36 years that we have been functional, we have helped bring over 8,000 babies into this world and hope to bring many, many more. We provide the entire gamut of services that you may require in order to complete your journey. And whether you're thinking of beginning this journey and simply want some questions answered or want to know where you stand, perhaps even consider delaying starting your journey and to have that reassurance that it's okay to wait for a little. We can help you through fertility assessments. This can either be for a single woman, single man, or a couple. And depending on who you are and what your circumstances are, it might either be one visit for a single man, or if you're a lady or a couple, it requires two visits. We offer 3D ultrasound scans. So if you are trying to get an ultrasound scan on the NHS and not having luck, or you've been told that there's something wrong and you're not sure and you have more questions, we can help you get a 3D scan. You may be waiting to get on the NHS waiting list for IVF, and because of the long waiting lists, long waiting times for HSG, which is a test to check the tubes. You cannot perhaps join the waiting list. We can help you there. We can do a procedure called HICOSY, which is very similar to HSG, and give you a report so that you can take it now to your GP and get on the waiting list. We offer saline infusion sonograms as well for those of you who have been told they have polyps inside the uterus and want to know whether it really is there or has or whether you need procedures to deal with it. At Herts Essex, we believe in a holistic approach to fertility and that a healthy body and mind and lifestyle can help you optimize your chances. And we have a website which is specifically dedicated to this end. I would like to refer you to this website called www.fitforfertility.com. And of course, our star dietitian, Alex, can help you optimize your weight. She can provide different formats uh, of dietary advice, whether it's for individuals or couples or one-on-one sessions, workshops. We have very good evidence coming in which suggests that having an optimal BMI can optimize your chances of pregnancy. And at the same time, if your BMI is more than it should be, this can get in the way of getting pregnant. It can increase the risk of miscarriage. So if you're trying to make things work as best as possible, this is a good step in the right direction. Treatment pathway always starts from fertility consents. So when you are due to start with a treatment, whether it is the simplest to the most complex fertility treatment, it always starts with fertility consents. So you have a login detail whereby you complete um, um, your forms online. This would give us information about what your specific history is. You can upload your investigations that you may have had in the past, and so that you don't waste time and energy and money repeating all those. We can use those if they are acceptable. We also require you to upload your identity documents to make sure that we are adhering to the regulations. And this is followed by a pre-assessment. So pre-assessment is a short 20-minute visit where and a nurse or a HCA will take down your observations, your weight, your height, and therefore will calculate your BMI, your blood pressure, and make sure you have completed all of the forms. Answer any questions that you may have in the meantime. Do your blood tests if you need them to be done. If there is a couple or a single man trying to have a treatment, we need to do a sperm test. So all that is done in pre-assessment. And the next stage is consultation. So this is typically online, but you can request for a face-to-face. We're quite happy to arrange for face-to-face consultations as well. This is an hour-long consultation with either me or one of my colleagues, and we would go through your history, discuss your investigations, and recommend the best way of treating your condition. We'll outline a treatment path and answer any questions that you may have, help you arrange for the next appointment so that your journey is seamless and smooth. We always encourage our patients to download Salve app, which is a very helpful app that helps you understand what's going on. It helps you get information regarding the medications that you've been advised, keep track of the appointments that you've been booked for, and also helps you to be able to ask questions that arise in your mind, and you don't have the time to wait for a phone call back. Perhaps you're working in the office, if you're busy, all you have to do is send a message and we will send the answer to that question, and you can see it in your own time and we can go back and forth so that all your questions are answered and you can move forward knowing fully what is happening and why it's happening. Before you can actually have the treatment, you have to have some screening bloods. That is, if you're a single person, of course, you're the only person having tests. But if you're a couple, both you and your partner have to have investigations, specifically HIV, hepatitis B, hepatitis C, and chlamydia and gonorrhea. If appropriate, the person who's providing the egg has to have blood tests for AMH, which gives us an idea as to what the egg reserve is like. The person who's carrying the pregnancy needs to have blood tests to check for hemoglobin level, hemoglobin type, what is called as hemoglobin electrophoresis, and test for rubella antibodies. Rubella is the scientific name for German measles. It's important that we find out whether your body has the ability to fight German measles, because if you get this infection while you're pregnant, it could cause harm to the baby. So if you do not have the antibodies to fight this infection, it may be worthwhile getting a booster or a full vaccination as appropriate before you attempt pregnancy. Now, as per regulations, the infection screens have to be within 3 months of the day that you have your egg collection. So, and we will accept any blood tests that are done at a UGAS accredited lab if you're unable or you want to do the blood tests at a place different from Herts Essex Fertility Center. Now, the simplest fertility treatment is intrauterine insemination. As the name suggests, we are inseminating the sperms into the uterus. Now, the couple that this would be most appropriate for are the heterosexual couples who are having difficulty having intercourse. It may be because of psychosexual problems, it may be because of vaginismus, or erectile dysfunction or ejaculatory problems. Single women or same-sex ladies who are trying to get pregnant using donor sperm may also use intrauterine insemination. And before you have intrauterine insemination, we would recommend the test to check for your tube. So this can either be a HSG that has been done on the NHS, or we can do a high COSI before you start the treatment. Now about the IVF, which is the more complicated treatment relevant for a lot of couples who are struggling with infertility. So this would typically start either on the second or third day of your cycle. So you let us know when the period starts and we'll arrange for you to come back for a scan. On this scan, we're going to check your ovaries, and so this would be the baseline scan where we find out how many follicles are there in the ovary, how big they are, and we know the starting point. The same evening onwards, you start taking medications that would help grow these follicles. Each of the follicle has an egg, and hopefully, as these follicles grow, eventually we can get the eggs out of these follicles. Now, as the follicles are growing, you may experience side effects such as headaches, mood swings, and then closer to the point where you have your egg collection, you might experience breast tenderness and bloating and heaviness of the pelvis. Now, the second scan typically is 5 or 6 days later. By this time, the biggest follicle is 11 to 13 millimeters, and it's time to start a second injection. This you would do in the morning every day, and it's important to take it at the same time every day because this is what is going to stop your body from causing ovulation. And you continue the evening injections to keep the follicles growing, and the morning injection would prevent these follicles from releasing the eggs. And we continue to monitor as well. And as you go forward, the follicles will get bigger and bigger. And these follicles are going to release estrogen hormone that builds up the inside skin of the uterus, the endometrium as it's called. And this is where the pregnancy happens. And so we are indirectly preparing the uterus to carry the pregnancy. The final scan will determine when you're going to have the egg collection. And this is typically when you reach a point where majority of the follicles are between 14 and 20 millimeters. And And this typically takes anywhere from 9 to 14 days. You have the final trigger injection, which contains pregnancy hormone, or HCG as it's called. This is a very critical point and makes most people nervous, including us. So we are going to give you written and verbal instructions. And of course, there is an on-call phone, there is the Salve app. So we're going to handhold you throughout the process so you never feel alone and unassisted. So 36 hours after you've taken the trigger injection is when we get the eggs out. On that day, we will tell you to come about half an hour before the scheduled time, and we will admit you to the recovery bay, take your baseline observations. The man will provide the sperm sample, which can start getting prepared so that we can use it to create embryos a bit later in the day. The egg collection itself is done under sedation. It's not a full general anesthetic, so you're still going to be breathing on your own. There's no tube going down your throat, but you're going to be comfortable when the needle goes in to your body to get the eggs out. The procedure itself may take 30 to 40 minutes, following which you're brought back to the recovery, and once you've recovered, you're fully awake, we will discharge you. Now, most of the action and almost all of the magic is happening in the lab. What happens depends on what treatment you're having. The simplest treatment would be egg freezing for those who are trying to preserve their fertility for later, because it's either not the right time for them to have a baby, or perhaps um, because of some medical condition, we've been asked to consider freezing the eggs so that they're able to have children when they meet the right partner or when the time is right in their life. With the change in HFEA limitations to 55 years instead of the previous 10 years, it has become much more easier and useful for women to preserve their fertility. Generally, the earlier you do it, the better it is, certainly before you turn 35 years of age. In case you're trying to have a baby, the simplest technique of creating embryos is what is called as IVF. Now, IVF is also used loosely for the whole treatment, but technically, IVF is where we, in simple terms, mix eggs and sperm together so that they can come together and form the embryo. This can only be offered to those couples who have normal semen parameters at consultation and should have had no history of IVF treatments where ICSI technique was used. In case the parameters don't reach the strict criteria that we have, or you have had a previous ICSI cycle. What is ICSI? ICSI is an acronym for intracytoplasmic sperm injection. Essentially, what it means is that we're going to take a sperm which has a normal structure, which is moving normally, and we physically inject it into the egg in order for the egg to be able to convert to an embryo. This is used where the sperm parameters don't meet the criteria, may be offered to those men who have very low or no sperms, may have antibodies and therefore have a MAR positive test. Or there are couples, not very often, but sometimes there are couples who have everything normal. They go through IVF and sperms are unable to fertilize the eggs. So they have either a complete or nearly complete failure of fertilization. No embryos form or very few embryos form. Such couples would be ideal to have ICSI, where we would inject sperm in order to achieve fertilization of the eggs. So this is a video of the ICSI. So this is called a micropipette, which is used to pick up a sperm, and you can see sperms in the background. This is a sperm which is not moving. So this is a sperm which is moving. We can probably not see the sperm that the embryologist is going to select. So the first step before ICSI is to immobilize the sperm. We need to stop the sperm from moving by flicking its tail. The sperm is then sucked into this micropipette. And now you'll see it being injected into the egg. So this is the cell of the egg. This is what is called as the holding pipette, which is holding this egg in place. And we take this sperm right to the tip of the micropipette, insert it into the egg. We suck it back so that we are sure that we've breached the membrane, and then inject it back so that it's definitely in the substance of the egg, and take it out. Now, you might find this quite damaged, but within a few minutes, it's impossible to know that this egg has been injected with this sperm. Right. Okay. So as a part of sperm analysis, we also do HbA testing. HbA stands for hyaluronan binding assay, and this is a surrogate marker for maturity of the sperm. In case we find that the maturity score is low, less than 65%, we would recommend PIXI, which is a special technique. It's got an extra step before the ICSI is done, whereby sperms that are mature can be selected specifically for injecting into the egg. Now, once the technique for fertilizing the egg has been done, they go back into the incubator, and we look at them the next day, which is considered the first day of embryo's life, which is when we hope to find this. This is the same cell that the egg was a day before, but with two circles within that represent the genetic material of the egg and the sperm. If we find more than two, that represents an abnormal or um, incorrect fertilization. So there is too much genetic material, and therefore such an embryo is not suitable for transfer and would be discarded. The embryo that is normally fertilized will continue to be cultured, and over the course of the next few days, so second day, we should see approximately 4 cells. These are the 4 cells, 1, 2, 3, 4. Third day, we should see approximately 7 to 8 cells. Of course, embryos may be slightly slower than ideal or faster than ideal, so you don't necessarily see all cells of equal size and exactly 4 cells on day 2 or exactly 8 cells on day 3. Sometimes when the number of embryos is small, if you only have one embryo, you may be offered the chance to have an earlier transfer, in which case you would have a cleavage stage embryo transfer. If you have 3 or more embryos, then we would recommend a blastocyst transfer, which is a 5th-day embryo. But before it can reach the blastocyst, 4th day after egg collection, it becomes a structure which is called as morula. This consists of lots of cells which are really tightly packed. We call this stage compacted embryo. And then the next day, we hope to find that one or more of the embryos reaches the stage which is called as blastocyst. It consists of a small bunch of cells in a corner, and this is actually multiple cells which are really tightly packed, and this would go on to form the baby. The rest of the cells are aligned in single layer on the periphery of the embryo and will go on to form the placenta. Between these two groups of cells, there's fluid, And as the number of cells is increasing, as the amount of fluid is increasing, this is going to increase the size of the embryo. That is going to thin out the shell around the embryo, which will eventually crack open, and you can see a little bit of embryo spouting out. So the embryo eventually will hatch out of this crack and get ready to implant and become pregnancy. We offer embryo transfers 7 days a week, irrespective of what day it is, whether it's a Saturday, Sunday, bank holiday. We do it every single day of the week. You will be given an opportunity to see your embryos, and we'll give you a A4 size picture of the embryo to take away with you. We offer the optional add-on treatment of embryo glue. It's a special transfer medium which mimics the conditions in the uterus to help the embryos implant, and is likely to help couples with implantation issues. We also offer biopsy of embryo. That may be either to find out if the embryo has the right number of chromosomes. This particular test is called PGT-A. There might be couples who have a pre-existing genetic condition in the family and are keen to prevent passing it on to the next generation. So we can offer PGTM. Now, it's important that such conditions are single gene disorders, and they also require HFPA license. So we have to be able to identify exactly what gene is causing that problem, and HFPA should allow that condition. That condition should be severe enough to warrant testing and selection of embryos. There might also be couples who are themselves normal but have a rearrangement in the way their chromosomes are arranged. And such couples may be prone to having recurrent miscarriages. So we can do PGT-SR to identify those embryos which are unbalanced, which don't have the full genetic information and therefore are likely to be miscarried. So we can select those embryos which are either completely normal or at least have a balance in that they have the complete genetic information for transfer. Any embryo that is not transferred but is suitable for freezing and suitable and of a quality that can give you a pregnancy later on will be frozen. We can offer you biopsy of this embryo before it's frozen if you want to. And then comes the 2-week wait. So during the 16 days following the pregnancy, egg collection, you would be taking progesterone medications to support the pregnancy. We call it luteal support to give you the best chance of pregnancy. And if the pregnancy test is positive, we offer a pregnancy scan 3 weeks later. We also offer NIP test, which is a optional add-on treatment, not treatment, diagnostic test. This can be offered to women who have completed 10 weeks of pregnancy. And through this test, the baby's placental cells that are circulating in your bloodstream can be isolated and tested for chromosome number problems, specifically with chromosome number 13, 18, 21, and the sex chromosome. Because we are looking at the sex chromosome, you can find out the sex of the baby if you want to. If you don't want to find out the sex of the baby and you want to keep it a surprise for later on, the report can be generated accordingly. Another type of treatment that we can offer is egg donation or sperm donation. Now, egg donation is typically offered to ladies over the age of 43, certainly over 45. We would not recommend doing self-IVF cycles. Some women may have an early menopause or may have had chemotherapy that has damaged their egg reserve. They may have had a previous IVF cycle and found that the egg quality is too poor to allow them to conceive. Some women are born without ovaries. It is also useful for single men or same-sex men who are trying to have a family with surrogacy. Sperm donation may be offered to couples where the man has no sperms in the semen sample because none is being produced, or may have had a chemotherapy that has destroyed or damaged the sperm production process. He may carry genetic condition that he doesn't want to pass on to the baby. Sperm donation is also a good option for single ladies and same-sex female couples to complete their family. We are quite well known for offering surrogacy and have completed over 409 cycles since 2012. We have a dedicated surrogacy team for the intending parents and the surrogates. Many cycles may also include an egg donor, especially in case of same-sex men. Single people using own gametes may also need surrogacy if medically indicated. And surrogacy is typically of two types: full or host surrogacy, where you create your own embryos and this goes into the uterus of a surrogate. So surrogate is not genetically related to either the sperm or the egg provider. Partial or straight surrogacy is where the egg belongs to the surrogate. So she is both the egg provider and the carrier of pregnancy. We have contracts with several ICBs, including Mid and South Essex, North Central London, and North East London. Now, please note that your ICB is determined by the location of your GP's address and not your own home address. If you're not sure, please feel free to visit our NHS webpage, and this will give you information as to whether you belong, this applies to you. So North East London ICBs include Barking and Dagenham, Havering, Redbridge, Waltham Forest, City and Hackney, Tower Hamlets, and Newham. Mid and South Essex include Mid Essex, Castle Point and Rochford, Basildon and Brentwood, Thurrock and Southend. And last but not the least, North Central London includes Barnet, Camden, Enfield, Haringey, and Islington. In case there is no NHS funding for your fertility treatment because you're over the age of 42, or you already have a child, or your partner has a child, there are other ways, and you can consider the option of egg share scheme or sperm share scheme. Okay, sorry. This is our March special offer, and if you're able to book your appointment by Friday, 27th of March, 2026, we are able to offer 50% discount on the consultation charges. Please note that this does not include the blood tests and semen analysis. You can consider the options of organizations such as Access and Assured, which provide 0% finance and have several different schemes, including IVF Unlimited, IVF refund packages, multi-cycle packages, and you can see if that makes sense to you. And this can save you money, but it's a bit of a gamble in the way it works. So if you get pregnant in the first cycle, you may feel that you've overpaid. But in case you do end up requiring multiple cycles or multiple frozen embryo replacement cycles, which they both provide unlimited and free frozen embryo transfer cycles, you might end up saving money too. At Herts Essex, we are very passionate about providing emotional support. if you've come across any of our patients, you will know that we work and function as a family, and um, all the patients are able to get the emotional support, positive vibes from us when they are here in the clinic, and also through our social media platforms, including Facebook, Insta, Twitter, and latest is TikTok. So, why us? We have many, many years of experience, over 36 years. We have 7 day a week laboratory service. So you will not have an embryo transfer that is done on the wrong day or not at all because it's a weekend. We have electronic witnessing system. So we see patients getting worried about whether there's going to be a human error in creating the embryos, or whether the right embryo will be put inside when they eventually try to conceive. And electronic witnessing system is a great way of preventing human errors. And each egg, each patient's egg, sperm, embryo is tagged using this technique, this system, which prevents the wrong egg and wrong sperm coming together to form the embryo, or the wrong embryo going into the person. So we are very, very confident of this system, and guarantee that there would be no mistakes. Over 8,000 babies proves the point in our, and proves that we have a lot of experience and can support you throughout your treatment. We also have free parking, which always helps. We value your feedback. I hope you have found this presentation helpful, and you have been asking lots of questions from Jackie. Please do let us know how you feel about this presentation, how you think we can make this better, and so that you get all the information that you came here for. Um, we would like to invite you to follow us on our social media channels. And in case you are looking to book an appointment, you can give us a call on 01992 7850 60. You can also email us at inquiries@hertsandessexfertility.com. New consultation is usually available within 2 to 4 weeks. I don't think it's even 4 weeks. I think it's within a couple of weeks now. Right. In case there are any other questions that remain unanswered, I'll join Jackie in answering those questions. And as again, I do apologize for not being able to share the virtual video with you. Thank you for your time. It was wonderful having all of you with us, and we hope to see you in person soon. Thank you. Bye-bye.